Hi, everyone. This is your People Behind the Science host, Dr. Marie McNeely, and I am excited to be chatting about life and science with another great guest today. This is episode 605, and we are joined by Dr. Shailesh Kantak. So listeners, if you've been enjoying our People Behind the Science podcast episodes, we would be really grateful if you could share our show with a friend or tell the world what you think about our program with a review on your favorite podcast platform. We have another wonderful conversation on the way today with today's guest, so get ready to meet another one of our phenomenal people behind the science.
Every day, discoveries are made that will change our understanding of the world around us. Dr. Marie McNeely is here to bring you the brilliant minds who are making these discoveries so they can share their incredible stories and take you on an amazing journey. Welcome to People Behind the Science.
Hello, everyone, and welcome to People Behind the Science. Today, I am delighted to be speaking with our guest scientist, Dr. Shailesh Kantak. So, Shailesh, welcome to our show today. How are you?
I'm good. Thank you. How are you doing?
I'm doing quite well. We are excited to learn from you today, to learn more about your scientific side and more about your life outside the lab. So let me start first by telling our listeners a little bit about your background. So listeners, Shailesh is a clinician scientist, an institute scientist, and director of the Neuroplasticity and Motor Behavior Laboratory at Moss Rehabilitation Research Institute, or MRRI. He is also a recently tenured assistant professor in the Department of Physical Therapy at Arcadia University. Shailesh received his Bachelor of Science degree in Physical Therapy from Seth G.S. Medical College and KEM Hospital at Mumbai University. He went on to earn his Master of Science degree in Physical Therapy with a specialization in Neurologic Physical Therapy from Mumbai University as well. Afterwards, Shailesh attended the University of Southern California, where he was awarded his PhD in Biokinesiology. Next, he conducted postdoctoral research at the Rehabilitation Institute of Chicago and subsequently the University of Maryland, Baltimore, before coming to Philadelphia and accepting his current positions. Now, Shailesh is here with us today to talk about life and science. And Shailesh, we are really looking forward to getting to know your scientific and clinical sides, but also more about you as a person. So can you start by telling us what you like to do when you're not doing science and teaching and research?
One thing I absolutely love to do outside science is I love to cook and feed my friends. So I really enjoy cooking. I think cooking is a lot like experimentation. So you might have a recipe that you see, but I never follow those recipes. I kind of take those recipes and make them my own. So I get to experiment a lot. And then I invite my friends for dinners and they love my cooking. So it's basically a win-win situation because cooking makes me happy. And when I feed them, they are happy. And when they compliment my cooking, I'm happy again. So it's a wonderful activity that I enjoy. I also love to travel, but now with the pandemic, traveling has just been a dream so far. Another thing which I also enjoy is gardening. So it gives me fun to watch a seed that I might plant and then that just grows. And I love roses and I love gardenia. So I really love to garden. So those are some of the things that I really love outside of science.
That is phenomenal. And I've tried experimenting in the kitchen myself. Sometimes it goes well, sometimes not so well. Do you have some, highlights in terms of some of the best things you've made or some of the worst?
I typically try my hand at Indian cooking. And when you say Indian cooking is so diverse in terms of the spices that are used across India. So I come from the western part of India, but I love food from all over. And I try different types of curries. I try different types of stir fries. And I think the other part about science and cooking both is that you have to have a little bit of an intuition about what would go well. And I think I do have that intuition when it comes to cooking, that I kind of feel like, oh, you know what? These veggies will go well with these spices. And then I try it. And 80 to 90% of the times things go well. And then there are 10% of the times, 10 to 20% where things just don't go well. It's very much like doing an experiment. Sometimes your results really fall in, they go along your hypotheses and sometimes they just don't. And you learn something new. That is how I approach it. It is the biggest stress buster for me.
Well, all this talk of food is making me hungry, so we're going to switch gears and talk about science next. So, Shailesh, how do you describe what you do to someone who's not in your specific field of rehabilitation and motor learning?
I think of myself as a clinician scientist who's driven by two main questions. One is, how can I help people with neurological injuries to recover better and faster so that they can go back to their lives? And the more curious part of myself is really interested in knowing why some people recover better and respond to some treatments better while others don't. So with these two big questions, I conduct experiments in the lab where we systematically study patient behaviors as they move their arms, as they perform different naturalistic functional activities. And then we try to understand how can we change their behaviors? How can we change their movements so that they are more accurate, more consistent, more sort of skilled? And then we try to understand why. I think why is a very important piece that has always appealed to me. Even when I was in physical therapy school, my instructors gave me a lot of wonderful techniques to work with patients. And I always had that question, why would I use this technique versus the other? And I think that why has led me into science. So what I do in my work is really try and find ways to improve patients' movement outcomes and try and understand why some techniques work for some people when others don't. Because that is going to give us a more informed approach into what we now call personalized medicine or personalized rehabilitation.
Definitely. And I think this focus on helping patients and the impact that your research can have can be really motivating for scientists. But I love talking to scientists about motivation. I think this is a fascinating topic. And I think there are particular maybe quotes or sayings or mantras or just forces that can keep people going, maybe particularly when things are going rough. So Shailesh, do you have a favorite quote or a saying or something that just really motivates you in your work?
I have a couple of them. And one of them is more of a big picture one. And then there are others that help me on my day-to-day basis. So the one that I really love is by Margaret Mead, where she said, never doubt that a small group of thoughtful, committed individuals can change the world. In fact, it's the only thing that ever has. I really like that because I feel like my journey as a scientist really began as a clinician, and I wanted to make a difference in patient care and patient lives. So I feel like a group of like-minded individuals who are committed and who are thoughtful, just like what we have at MRRI and at Arcadia, where I work, both these places. I feel like our work really has the potential to change the world of rehabilitation. So that's the big umbrella principle that I'm always inspired by. And then there are two others. One of them is kindness is free. Being kind is always something which I strive by. That is something which my mom always has said. Even when I was growing up, my mom always said, kindness is free.
Oh, I love it.
And the last one, which is what I live by, is be stronger than your strongest excuse. So anytime I feel like, well, I don't feel like doing it because, and if that excuse is just preventing me from doing something that I really should do, I kind of remind myself of this.
Oh, those are fantastic quotes. Listeners, I'm feeling motivated already. And we touched on some of these people. You mentioned your mom as someone who had an impact and some of the great people that you work with there at MRRI and at Arcadia. And I think as a scientist, working with wonderful people and having these people in your lives is definitely one of the benefits. So when you think about your own experiences, Shailesh, are there people who really rise to the top in your mind as role models or mentors or just people who've had a big impact on you?
Absolutely. I think I am a product of so many wonderful people who I have worked with. And I have been extremely fortunate that I have been able to work with people, and these people are from different walks of life. I have always been inspired by many of my teachers who I have been so fortunate to have an amazing group of teachers. Some of my patients who I treated even in the late 90s and early 2000s are in touch with me even today. So that is always inspiring, that you feel like what you do matters. And of course, within the scientific community, I have had some great role models. And there are so many of them, but I'm going to talk about one of them, and one of them who I really respect and I want to be like that person is John White. He's extremely thoughtful, and he is also a clinician. He's an MD, and he is a scientist. And he can really speak both those languages, which I find extremely important when it comes to rehabilitation research, because you not only want to do your science, but you also want to communicate that science with the clinicians and be able to understand where the clinicians are coming from. And that dual hat that sometimes he puts on as a scientist and as a clinician is important for this infusion of scientific research into the clinic, ultimately to improve patient care. So John is definitely one of them, John White. The other one is one of my PhD advisors, Carol Evenstein, who is also a wonderful and a very successful clinician scientist. And she's my inspiration because she is someone who is super creative. I really look up to her creativity. And one of the things that I learned from her, which I always keep in mind, is you may be able to go far if you just do things by yourself. But she really encouraged a lot of collaboration and how to really be humble and use different people's strengths to actually make your project much better. So when I was in my PhD program and I was working on my dissertation, I was very hesitant to kind of go out and seek someone from cognitive psychology to inform my dissertation. And she really implored me to do that, which I initially was very uncomfortable because I did not know that field and I felt like I would expose my weaknesses there. And she basically said to me, she was like, well, the reason why you want that person is because you don't know that stuff. And it just was a switch that went in my mind like, oh yeah, this person's expertise is important for my project. And I don't know that field really well. So I want to go and ask for help. So that just changed how even today I do my research. So I think as a scientist, these two people, I would say, are two inspirations. And I'm really fortunate to have other people who also inspire me. But I think if I have to give two people, I would give Dr. Carol Evenstein and Dr. John White.
Oh, phenomenal. Well, Shailesh, I'm really glad you mentioned particularly the situation in your PhD where you were sort of hesitant to ask for help, because I think many of us have been in that situation where you feel like the PhD process is a test of your skills, your intelligence, and your ability to solve problems, right? And so you're like, wait, no, I can't ask for help.
Yes, exactly. And it was a very liberating feeling because at the base of it, she said, you're not going to know everything you need for your project. And what's more important is that you get the expertise for your project that you need rather than hiding your weaknesses. So that feeling was extremely liberating for me. And I think even today, I stand by that. I collaborate with a lot of wonderful scientists that has really changed the way I do my science and has made me a better scientist, a more successful one.
Definitely. Well, I think such an important lesson. And you mentioned that as a physical therapy student already, you were sort of constantly asking why. And I'm curious, maybe what originally drew you to physical therapy or this sort of clinical education path that you were pursuing?
One of the things that drove me to physical therapy was that I am a person that cares about people and I kind of connect with people and I really like empowering people. So when I was thinking about a career, I had a couple of options. One of them was being a physician and then was being a physical therapist. In India, the way admissions work is that you give this state level exam and you either get into the MD program and there is a list. And so the top, whatever, 70 people get into MD and then the next go into dentistry and then some of them go into physical therapy and so on. So I was always interested in not only studying, but I was also interested in a lot of other things. So for that exam, I really didn't study as well. So I did not get into the first 75 people. And so then I had a choice between dentistry and physical therapy. And I was like, I would do physical therapy. I kind of enjoy working with people. I kind of enjoy empowering them. I like to comfort them in terms of their pain and things like that. So I was like, okay, I think physical therapy is for me because I think as a physical therapist, it's a very personable profession. You have to work with patients and you are a partner in their care. And eventually patients trust you so much that they vouch for you. So I was like, I like that. It was the people's aspect that drove me to physical therapy.
Oh, very cool. And then what maybe you mentioned you had this sort of innate curiosity. What made you decide to get that master's degree and sort of add science officially to your career?
That's a really fun question because as a physical therapist, now this is way back in late 1990s, I was definitely interested in the brain and I was interested in neurological rehabilitation. And at that time, neurologic rehabilitation was dominated by different approaches in physical therapy. People had different schools of thought, and a lot of them were more treatment approaches that were developed by these clinician experts. And those clinician experts were ahead of their time, and they contributed a lot. So they developed their own protocols and their own approaches to treating patients. So I would go to, after I graduated, I would go to a lot of these continuing education programs to kind of get those skills. And as I was learning, there were two things that became apparent to me. One was that I was learning those things over the weekend and coming and applying those to patients over the week as I was a treating therapist. One of the things that I saw was some patients really responded well, while others did not. So there was this inter-individual variability that was something which just was remarkable. And I remember seeing two patients having very similar lesions in the brain, but their movement outcomes, how they got back to their life and how they recovered, their walking was considerably different. So that led me to ask questions about why. Why did one individual who was of very similar age, similar socioeconomic status, why did he recover while this other patient did not? And that just blew the lid on my curiosity because when you have very similar brain lesions, you typically expect them to be behaving very, very similarly. Mm-hmm. But that was not the case with these two patients. One of them actually got back to working while the other one stayed at home and did not work. And I treated both of these patients for almost 6 to 8 months after their stroke. Both of them reached very different functional outcomes, and that just made me more interested in understanding why. So that was one part. And then the second part was I was trained in the traditional approaches in physical therapy. And these traditional models, for example, believed that you should not strengthen patients with stroke because that will increase their spasticity. And when you tell your students that, I, as a student, just imbibed it. And then went on to another course from this group of physiotherapists who were visiting that time from Australia. And they said, we need to strengthen these patients because they have a force production deficit. And I was just sitting in that audience thinking, oh my God.
That light bulb moment.
Yes, it was as simple as to strengthen or not. And these guys provided scientific evidence with patients and said, here is why we think. And that just forced me to go back and try to see this evidence of if strengthening would increase spasticity. And there was no evidence. And I had already been in practice for over a year and a half, and I was never strengthening my patients. So on one hand, I felt extremely guilty for not providing the best care. At the same time, I also recognized that understanding data and looking at these important research studies is going to be crucial for delivering the best care that I could. So that led me down to really a lot of reading and then getting interested in asking questions about why some patients recover, some patients don't. What are the underlying processes? When do we do what we do in rehabilitation? And those answers can only be unraveled through research. That is what kind of led me to my journey as a scientist.
Definitely. And I know, Shailesh, you've got some fascinating projects going on in the lab right now. So is there one in particular maybe that you are the most excited about at the moment that you want to tell me and our listeners about?
Sure. One of the projects that I'm really excited about is this project on bimanual coordination. So as neurotypical individuals, as we call individuals without any brain injury, we use both our arms, and this using both arms is quite ubiquitous. Although we call one hand dominant and the other hand non-dominant, research has shown all along that we use both hands almost equally during activities of daily living. So both arms just give us that efficiency of movement. The next part is that we just don't move our arms randomly, but they are quite coordinated to interact with each other in order to manipulate objects or move objects, even carry out a lot of tasks. So the question at the base of it is, how do we really coordinate these two arms in time and space? Because they're so well coordinated, they're so adept at interacting with each other, and it looks so seamless. And we do it all the time, right? From squeezing out toothpaste onto our toothbrush to then finally just pulling our blanket. It involves both hands. So the question really is, how do we coordinate these hands? Now, after stroke, when one side of the body is affected or weak, this ability to use both hands is affected, and patients typically tend to use only their good side. And they do that despite having the capacity to move their weaker hand. Also, when they are asked to use both of their hands, these two hands are not coordinated as well. And so the question is, how and why do patients with brain damage have this difficulty in using their arms together in a coordinated way? So what we do in our lab is we test their ability to move, their performance on different tasks. And we also, we quantify that coordination using motion capture and then use neuroimaging and brain stimulation techniques to understand which of the circuits are involved in these patients that lead to these deficits in their bimanual coordination. So it not only helps us understand what are the subset of patients who would be at a greater risk of having these coordination deficits, but it also provides insight into understanding which brain regions implement this complex process. So I think the information that's coming out from this study is going to be helpful not only in advancing patient care by identifying this subset of patients who have those deficits, but also provide some critical insights into the brain regions that are involved in this process.
Oh, very interesting. Well, Shailesh, thank you for telling more about one of these exciting projects going on in your lab right now. And I think doing this clinically relevant kind of research that you do comes with a lot of challenges. And in general, as a scientist, I think all of us have had these days where it just seems like everything is going wrong. So for you, is there a particular time you can think about in your career, whether it was long ago or yesterday, where you were really struggling with something or you had a major failure, and maybe explain how you've been able to work through it?
You're right. Science is a lot of fun and I enjoy it, but the endeavor of science also has a lot of ups and downs. And some of my downs have been early on when I joined MRRI as a scientist. I was writing these grants all the time and was not having success in those grant applications in getting funding. And those were some of the most challenging times, but those were the times when I learned the most as well. And the way I was able to work through that tough time was I really persevered. At a time when I felt like giving up, I said, no, I'm not giving up. So I think perseverance played a huge role in that. And the other big thing that I think I did was I was always flexible and open to feedback to make my work better. So I think that was another thing that I learned to do. If I wrote a grant, I thought that it was the best grant ever.
Yeah, of course.
But when I gave it to one of my colleagues or mentors to read it, and when they suggested changes, I was open to those changes. I was flexible and I said, I'll edit it. And that led to a better product eventually. Because a lot of times early on, when I was a young scientist, I would take these big bites in each project. And that was one big mistake that I really had to kind of let go. Like I remember writing 3 aims and then going and sitting amongst my really wonderful colleagues at Moss. And they said, you should just take the first aim and break that first aim down into 3 aims, and that would be your grant.
Oh, wow. Yeah.
And the first time they told me, I was so disappointed. I have done so much work. And I said, I want to give this a try for the next 1 or 2 weeks. And in the next 2 weeks, I kind of broke down that aim and wrote a specific aims page with that aim. And it was extremely helpful. And that grant was funded. So I think really being flexible. And lastly, knowing what you know and accepting what you don't know. Those things are really important. And being nice to yourself and being forgiving to yourself for not being too hard on yourself is what another thing was, because you can easily internalize that you're not getting funded. That can be easily one of the things that one can internalize. And I did it for some time. But I think I soon realized that that was not helpful at all. So those were the ways I was able to work through that tough time. And having wonderful colleagues, and I can't emphasize this enough, the interactions you have with your colleagues and your research group are biggest determinants of the quality of life as a scientist. And I think that is very important. Without those wonderful interactions, very supportive interactions, they were challenging. Absolutely. They challenged me a lot. Even my research assistants often challenged me in some aspects of my work. And I think that is important. But those positive interactions are so important, especially during those tough times.
Absolutely. And Shailesh, I appreciate you being so candid about these difficult times for you. And I think so many of our listeners, I'm sure, are commiserating out there with this struggle to get grant funding. And you mentioned that this project was ultimately successful in the example there. And I'd love to talk about some of your successes as well, because I know you've had quite a few. So is there a particular favorite success you want to tell us more about?
I've been fortunate. I have had some good successes. Besides grants and papers, getting grants funded and papers accepted, it's always a good time. And those successes are important. One of our scientists, MRRI scientist, Myrna Schwartz, once told me, she said, you have to enjoy your small successes because that is how you're going to get through this. So even getting a paper accepted or a grant funded, I really enjoy those successes. One particular success, and maybe this is because it is a recent one that I really am proud of, is a paper that my colleagues at Arcadia University and I have published. We proposed this framework for assessment of movement deficits in patients with movement disorders, patients who have difficulty moving. It's a comprehensive, systematic framework that helps clinicians, physical therapists, analyze movement and hypothesize about different contributors to that movement deficit. That paper has gotten a lot of attention from the physical therapy world. And it has an impact. It has had a direct impact on how clinicians think, how educators educate the clinicians. And I think that is going to change how people evaluate and treat their patients. And I think providing that framework, which is a conceptual framework, but in addition to being a conceptual framework, we also give ways in which you can assess them. I think that paper has had a big impact on clinical education. The other success that I feel I had was when my grant got funded. So that was my NIH R01 got funded. Mm-hmm. I still remember every event when I got the notice of award. I was at home in the morning at 8:15 and I opened my email and my heart rate was through the roof. Mm-hmm. And my parents were visiting me and I just ran down and jumped and hugged my mom and hugged my dad and I was extremely happy about it. So I sometimes ruminate on those successes just to keep myself motivated sometimes.
Oh, absolutely. Well, congratulations on both of these successes, the paper and the grant as well. And I know as a scientist, you spend quite a bit of your time writing these papers, editing them, and also reading them. And I think it's nice to maybe take a step outside of the scientific literature a little bit every now and then to read for fun as well. And we encourage our listeners to do the same. So Shailesh, if you've read any good books recently or even long in the past, is there one in particular or maybe a few that you want to recommend for our listeners to add to our own reading lists?
One of the books that I really like is this book by Daniel Kahneman. It's called Thinking Fast and Slow. And it is a very interesting book on human behavior. And it really helps you understand how people behave and also how you behave. It is about how your brain having these two systems. One is sort of this impulsive automatic system that just oftentimes it's not intuitive, but it is just impulsive. While the other one is a little conscious and measured and aware. And he talks about how our behaviors are driven by these two systems and their competitive interactions. And it's after I read that book, it was really fascinating to see people's behaviors. And I would be thinking to myself, well, that is because of that fast system. Mm-hmm. That is because of that slow system. So I really liked that book a lot. It also helped me think about how I should think in some cases. That is one book. It has a little bit of science. It is a little psychological, but I like that book. I also liked Michelle Obama's book, The Becoming. It was good to see her life coming from a very modest background to where she is, and she can have an impact. And I think that is another that I really liked as well.
Well, excellent recommendations, Shailesh. We will add these to our reading list on our website for our listeners. And I know we touched on it at the very beginning of our conversation when we were talking about your interest outside of science. You do have this passion for travel that's been, unfortunately, a bit stifled in the past year or so. But I think in normal days, as a scientist, you get to travel quite a bit. So when you think back over the places that you've been for science, is there one that really rises to the top of your mind as your absolute favorite place you've been?
I don't think that has come yet.
Oh, I love it.
I mean, I love to travel. I have traveled for scientific conferences, but one of the places that I absolutely loved, and I have not traveled a lot, even though I love traveling, I have not yet traveled. Mm-hmm. One of the places that it was breathtaking was Highlands of Scotland. Those highlands were just marvelous. They're so beautiful. They make you feel one with the nature, but also make you feel so small because it's just magnificent is the word.
Oh, wonderful. Is there anywhere else on your bucket list that you're sort of shopping for conferences in the future or places that you want to go?
New Zealand is one place I would love to go. But yeah, it is my dream to actually go and rent out a cottage in one of those highlands. Mm-hmm. And my last grant of my career, I'll write it there.
I love it. Well, Shailesh, thank you for talking travel with us. I know it's something that most of us have been doing in our dreams only lately, so we're living vicariously through the memories of everyone on the show. But I think as scientists, you're often portrayed in the media as being very serious and very critical. And there are a lot of stereotypes about what scientists are like and what life as a scientist are like. And I think in many cases, they're just not true. And I think as a scientist, people are thinking about their work a lot and it's very important to them. But people who are in science are funny and creative, and they have many different facets that I think often don't get to see the light of day. So I love talking about this human side of science and some of the traditions and memories and just fun and funny things that happen. So Shailesh, do you have an example from your own experiences of one of these human moments in science that you could share?
Sure. So one is when I was a graduate student in Carol Evenstein's lab, we had this international potluck parties. And our lab had people from all over. We had people from Taiwan, people from Thailand. I was born, raised in India. There were people from everywhere in the United States. There were people from France. We had this international potluck where you would make one dish from your home country and bring it to the potluck. And by now, you know my interest in cooking. Mm-hmm. That was one completely fun event. It was a tradition in that lab that I absolutely love. If I grow my lab to the extent that Carolee had, I would love to do that in my lab. You get to taste food from all over the world. So that's one fun tradition. The other tradition that I really find very quirky is that at MRRI, we have a holiday party every December where we play this white elephant game where you sort of bring gifts and then you're given a number and then you go and pick one of those gifts. And over the last few years, we have had this very weird showpiece where there are dolphins and penguins holding hands together.
It sounds marvelous.
All the institute scientists at MRRI make sure that we bring that to one of us. So I find that extremely quirky tradition at MRRI, where even if some of the research assistants or if anyone else has taken that, we make sure that one of us gets that, and we recycle that every year. So I find that extremely funny and I enjoy it.
Oh, that is amazing. So what is the best gift that you have contributed to this fabulous game?
I think the best gift I had given was a lab PI voodoo.
Excellent choice.
It was a voodoo doll, and that doll had pins, and each pin was about a publication or a grant. So it was hilarious.
So you were hoping your research assistant didn't end up with that one?
I don't know, but that was the one I found in one of these stores. And I was like, oh my God, a pin for each grant, a pin for each publication. And one of my research assistants then was like, yeah, I think we should get that for the lab. So every time we get a paper published, we would pin this voodoo doll. So I don't know where that voodoo doll is now, but...
Oh, that is fabulous. Well, it sounds like a fun tradition and a great way to get everybody together to talk about things outside of science, get creative in your shopping. So that is phenomenal. And it sounds like you've got a great environment there with everybody at MRRI. And I think that's so important because you're tackling some of these big questions. Having those colleagues and conversations and collaborations is important to addressing them. So Shailesh, if we took away all of the normal barriers that you face and you could do anything, all of the funding, staff, technology, feasibility things that normally stop you are out of the way, what is the question you would want to answer first or the problem that you would want to tackle most?
One thing that I would do if there was no constraint was I would get a group of patients, clinicians, scientists, and engineers and policymakers, all of them in one room for a whole 2 weeks and talk about what are the most important problems that need to address. Because I think what happens in rehab is everyone feels that their question is the most important question. We have a lot of important questions we want to address and answer. But very, very rarely are opinions of patients even considered. As a scientist, I think I know it all. And I may not know it all. I might know a part of it. And what matters to these patients is extremely important because they are our ultimate end users, right? So I would really foster communication between all of these people. And I think that will hugely help how science is done and how it can be translated and how it can actually have a real world impact.
Definitely. Well, Shailesh, I love this idea. And you've shared so much with us in terms of insights and your research and your stories. I'd love for you to share one last thing at the end of our conversation, and that is advice. So for our listeners out there who might need a little bit of inspiration or advice themselves, is there a particular piece of advice that you received at some point that you think really helped you that you can pay forward to everybody out there?
One is be kind. Kindness is free. And be kind to yourself as well as others. Respect people for who they are. Everyone's perspective is coming from their own experience. And it might be a little different from yours, but that doesn't mean that yours is less valid or theirs is less valid. If we sort of think big picture, and even I think that's important even for reading. I think read a lot, but always put it into a bigger picture concept. And that frame of reference is so important for everything in life. And lastly, working hard and persevering are the most important things. And be open to change. One thing that is constant is going to be change. Things are going to change all the time. So if you forgive yourself, you are always open to saying, oh, maybe that was not the best way. I'll do it in another way. If you don't forgive yourself, then you either completely give up or you get stuck to what you first thought or proposed. So I think be kind, be perseverant, and think big.
I love it. Well, Shailesh, wonderful advice for our listeners out there. Is there anything else you wanted to share? Any last note of inspiration you want to leave us all with at the end of our call today?
Well, I think science is a wonderful human endeavor. And as scientists, we do have a privilege to not only perceive what our passion is, but also to kind of change human lives. And so I think if we constantly keep an eye on that part, then science becomes more fun, it becomes more meaningful. And I think that meaning becomes important as you grow older in your career. As a young scientist, I was only focused on my theoretical frameworks and my experiments, and which I even today am. But as I have grown to be a little older, I have started asking questions about the meaning of that work and the meaning of where this is going to go ultimately. And I think that meaning will make things more meaningful, more rewarding in the long run.
Certainly. Well, Shailesh, wonderful note to end on today. If our listeners are intrigued and they want to learn more about you and your work, what is the best way for them to do so?
The best way for them to do so is look at my webpage. Our lab has a webpage on MRRI website. So it is mrri.org. And in that, we have our Neuroplasticity and Motor Behavior Lab website. We have a page for me, also on Arcadia Physical Therapy Department. I have a webpage. So those are two main areas where you might get to know more about me.
Wonderful. Listeners, definitely check out those resources. Shailesh, thank you so much for joining us on the show today. It's been such a pleasure to chat with you.
Thank you so much, Mary, for having me.
Absolutely. And listeners, as always, great to have you here with us as well. We'll see you next time on another episode of People Behind the Science.